My name is Councillor Lorna Bogue, and I am the leader of Ráirte, the Party for Workers and Carers. It feels good to say that because we've spent the last couple of years defining our party's purpose. And to me, that purpose is very clear. Workers and carers do not have political representation or power in the political system, in the economy, in workplaces, communities, or even homes. Our objective as a party is to be a catalyst for a mass representation of workers and carers. Currently, the idea of an economy under democratic control, which prioritises the well-being of the population over market performance, is so unimaginable to most people in Ireland that none of the major political parties have ever dared to propose it in their election manifestos. We want to change that because if it is to survive the coming decades, our economy needs to be restructured along democratic principles. The attitude that informs the mother and baby homes redress scheme is the same as that which informed the referendum on care. The results show that people are not tolerating this approach anymore. A transition, green or otherwise, for elites alone is not one that, in our view, addresses the climate problem. The political system, workplaces, communities and homes need to be democratised. Without this, there is no transition to a post-carbon world or to a more socially just economy and society. This is the core business of representatives of our party, and we think that it is in places like Limerick that the type of restructuring that prioritises workers and carers can take root. For the type of agency required to bring about this restructuring is not only possible, but is here with us today. I'm a councillor with Cork City Council, and I think that it is possible for councils as anchor institutions to have a huge role in democratising our economy. The new role of a directly elected mayor should have had this goal, but the government sees it more as a gimmick than something serious. We see it as a serious opening for a new kind of politics. We are running a candidate in this election to win. And because the person elected will be the first person in this role, a solid candidate is needed to redefine the role for future generations. As a Limerick person myself, this is personal. I want this mayoral role to work for the people of Limerick. I don't want this opportunity to be squandered on a voice for the establishment. I want somebody strong, qualified, and compassionate. To this end, I can think of nobody better than Dr. Laura Keys to do it. Laura is a hugely impressive candidate and a comrade who has educated and enlightened our party on the realities of life for people with disabilities and to the hugely important aspects of public health. Members of the public and party members, a humrádaí, I am delighted to officially launch the campaign of Dr. Laura Keys for directly elected Mayor of Limerick City and County. This is a very exciting opportunity for Limerick to have somebody in a top role in council who will really champion Limerick as a place for workers and carers. Across Europe, directly elected mayors are powerful actors for local government. Limerick needs somebody who will really champion accessibility, health and social care services, transport and infrastructural development nationally and internationally for everyone in the county. It also needs a person who can engage with and represents the interests of the workers and carers to whom Limerick belongs. Dr. Laura Keys is all of these things, and I am so looking forward to campaigning alongside her.
Yes, just for the visual description, we have Dr. Laura Keys, a white woman wearing a blue blouse, dark blonde hair, in front of a pale background.
Thanks, Ashling.
I'm very pleased to be announcing my candidacy in the mayoral election for Limerick. And I want to thank the party for their support. This mayoral election is an opportunity to make a bold statement about the type of city, county, and country we want to bring about. The powerful in this country never intended to give us a mayoral position that would open possibilities for workers and carers in Limerick or elsewhere. And because we're so used to the status quo, it can be hard to imagine the possibilities. So what are they? Well, in some ways, they are simple things, such as living locally to your working family and not worrying about sky-high rents or being evicted, not having to pay for private transport and health insurance to avoid unreliable public routes or long medical lists, or the possibility of feeling like your voice is heard and that it matters in public debates. Our city county could be built so that the currently marginalised flourish and thrive, rather than simply to generate the profit of property developers and landlords. I know Limerick. I have witnessed her triumphs and challenges firsthand. I have seen the strengths of our communities, the resilience of our people, and the untapped potential on every corner. I have very deep in Limerick. I'm from the North Circular Road in Limerick City. I went to Salesians Primary School and then Laurel Hill Coláiste on the South Circular Road. I was born here, as were all my family, back to my great-grandparents. In fact, both my grandfather and my great-grandfather were mayors of Limerick. The story of my great-grandfather, Michael J. Keyes, is one that resonates with me. Although probably forgotten to living memory, Keyes Park in South Hill was named for him in honour of his representation of workers in Limerick. I want to continue this tradition of representing Limerick people, especially workers and carers, and people with disabilities who have routinely been treated with contempt, most recently in the referendum. As a worker, a parent, and a person living with sclerosis, I know we need a voice. I'm looking forward to this first ever directly elected mayor campaign, not least as one of our party's first electoral candidates, but also to have the opportunity to take forward our party's ideas to 200,000 workers and carers in Limerick. The foundation of our political idea is that workers and carers can and should have more say in their homes, workplaces, communities, and in the political system. We need ideas that take us off the autopilot course that we have been on for so long. Concrete proposals that empower people and improve everyday life for all. When I say we, I mean all those who work, care, or are cared for, both in Limerick and nationally. The mayoral position has been created with the expectation that it will reinforce the status quo. I'm standing for mayor to challenge that assumption. I'm also here to challenge the idea that there is something not serious about the mayoral role. To me, it is a position that can be used for social purpose and positive change. The challenge to utilise the levers the mayor has been given, both statutorily and as a political broker with the national level. I want to use the position created by legislation earlier this year to advance a mayoral programme that grapples with the real problems faced by the people of Limerick. The list is long. The state of housing infrastructure and of health services in Limerick are costing people their lives. The way to address crises, whether at the level of Limerick Hospital or the climate emergency, is to put workers and carers and the least protected first. Limerick has serious public health problems with water and air quality. These flow from austerity and the housing crisis and require coordinated responses across the local and national levels. Responses that I can broker as your mayor. As a public health scientist, I possess skills in problem solving and decision making, but also, crucially, in collaborative work with ordinary people. Work that platforms their voices in tackling issues that impact their lives. Not using people or communities as one-time consultants. Not using consultation as lip service. Instead, my whole vision and practice involves putting the affected people at the heart of the planning, from start to finish. The voices of environmentalists and biodiversity advocates are also too often marginalized and ignored. We need to hear from the people who understand our land, farmers, ecologists, conservationists. We need to meaningfully move towards local and global food security. The energy transition away from fossil fuels towards renewables needs to benefit ordinary people and not just line the pockets of international investors. My campaign will actively seek input from workers, carers, those who are cared for, and especially from a community of which I am a member, people with disability. During the campaign, I will be taking my proposals across Limerick for people to engage freely with in order to develop a mayoral programme for all. If elected, I can recruit and work with councillors in a joined up way that supports people-driven planning and development. With the election of Ireland's first directly elected mayor, we stand at a pivotal moment in Limerick's history where bold, progressive leadership and innovative solutions are needed to address the pressing issues that we face. My mayoral programme currently has 5 central themes, but it is also a set of proposals for transformative change. The 5 central themes are accessibility for all, transparent governance, open democracy, social justice, housing, education, healthcare for all, and climate action for the benefit of all. That repetition of for all is a statement in and of itself. Limerick should be for everyone. My mayoral programme will be firmly within the statutory capabilities and operational capacities of the mayor and the council. I'm really looking forward to talking about these proposals with the people of Limerick. As a person with a disability, I know that limitations are there to be overcome. Together, we can surpass expectations for this role. If elected as your mayor, I commit to prioritising transparency and accountability. Accessibility will underpin all actions and plans. I know that if you design for the least able, everybody benefits. I envisage a Limerick where housing isn't a constant worry. Our hospital functions as it should. Our economy thrives. A Limerick where sustainability is not just a buzzword, but a way of life. A Limerick that faces up to the realities of the climate crisis. A Limerick where diversity is cherished as a source of strength and enrichment. However, I cannot achieve this vision alone. We need to work hand in hand to co-create a brighter future for ourselves and generations to come. I'm ready to lead. With your support and trust, prosperity that she deserves to be.
Thanks, Laura. Now we will have a short question and answer session. I'm going to welcome back all speakers so they and Cormac will be present on screen. If any deaf attendees would like to ask a question in ISL, Cormac can interpret. Just let us know in the chat and we will ask you to turn on your video so you can sign to Cormac. So I'm just checking now with our questions. Okay, I have a first question for you, Laura, and it's a pressing one. What would you do about hospitals in Limerick?
Thank you very much, Aisling. I'm not unsurprised, actually, that a question about hospitals has come up. It is very much front and center in conversations in Limerick. So I suppose the first thing to say is that the hospital is not directly within the remit of the mayor, but that is not to say we can't do anything. In fact, the mayor can do an awful lot to reduce the burden and the pressures on A&E and the hospital. The big problems, as I see them, and there are a number of them, all do have solutions. So the first one is that in Limerick, we operate within the hospital group. So we have 6 hospitals in our hospital group, and UHL is a Model 4 hospital. That means it will take everyone, and it's got a 24-hour A&E, and it will take you regardless of what ailment you have. We have no Model 3 hospital. So that's the one step down where you have more limited services, but still quite comprehensive. Instead, we have 2 Model 2 hospitals, Ennis and Nina, within our hospital group. This is completely different to all the other hospital groups in the country, where you have Model 4 hospitals supported by a Model 3 hospital. The mayor can leverage for change in this. They can leverage to get us an uplift of one of our Model 2 hospitals to a Model 3 hospital. That will then reduce the amount of people that need to go to UHL because they would have other options. The second issue that UHL faces is one of staffing. And I'm now talking about staff positions that have been sanctioned and funded, but are not filled. So why aren't they filled? We train those staff here in Limerick. We have phenomenal universities that are pumping out nurses and doctors and physios, and yet we can't get those people into the positions in Limerick. So the first thing the mayor can do is liaise with the universities who are training these staff to find out why exactly these people aren't staying. The next thing we can do is sort out the housing issue, because we know that people cannot find housing in order to live here to be able to work in the hospital. We also need to make Limerick a place that people want to live and grow old in and raise their children in. We want to make it somewhere that people want to stay. Third big issue for the hospital is the lack of community-based services. So we don't have enough services in the community for people to use, which means they end up in hospital when really it could have been prevented. A hospital visit could have been prevented. It also means on the flip side, when somebody is ready to be discharged, often there's nowhere for them to go. So no nursing home space, no respite, no home-based care packages available for them. So they end up in hospital for a prolonged period of time, taking up bed space, which then puts backwards pressure on the A&E. Now, I'm only going to give you one more problem on it, because I could actually sit here and talk about this for hours. But the last problem, and it's one that I do think the Mayor can address, is the overall health of people in Limerick. We do have an enormous air quality and water quality issue. If we improve the overall health of people living in Limerick, then it reduces the amount of people that will need to go to hospital. So if we tackle the air and water pollution and we support active travel and increase green spaces, these are all things that are known to promote overall health and well-being. So then we would have a healthier population, less dependency on a hospital. Our hospital caters for 400,000 people. It's an enormous amount to cater for. So the less ill people, the less sickness and injuries that we can have, the less of a burden on the hospital.
Thank you, Laura, for that. I'm just going through our questions, and we do have some really good ones. Okay, so this one, again, I think is coming up a lot in the mayoral election and wider debates, is how would you as mayor work alongside councillors, given the role is new and not clearly defined? And that's for Laura at the moment.
I think Lorna actually wants to answer.
Sorry, I actually would love to just jump in on this question, if that's okay. So as I sort of outlined in my endorsement of Laura, I'm a sitting councillor already with Cork City Council. And I suppose I have been keeping an eye on the discussion that has been happening here, because I'm from Limerick. We in Cork City unfortunately did not vote to have a directly elected mayor, but I suppose it seems to me that Laura actually has a really good grasp of what the role is. I can tell you personally that Laura has read the actual legislation from cover to cover, has printed out every single edition of it, and gone through it with a highlighter. So she is well aware of the, I suppose, the capabilities of the role. And you know, obviously I'm biased as party leader, but I suppose from putting my councillor hat on for a moment, I would say that having someone like Laura in that position, because we fight with the chief executives of council all the time. It's a constant, never-ending battle to try and get the interests of workers and carers across. I think that Laura will work really well with councillors. And I think that the councillors would be quite lucky to have somebody like Laura there, because she is willing to listen to people, she knows what the role is, and she's willing to actually go beyond the boundaries of the role as it has been set out in the legislation. So I think that she'd be really good in terms of having a good relationship with councillors, because I have, again, I am biased, but like I have been paying really close attention to the debate that has been happening around the Mayor of Limerick. And I think that a lot of candidates running for it don't really seem to have much of an idea of the role of councillor. Now, these are the ones who are not councillors themselves, but you know, they seem to kind of denigrate the connection that councillors have with our local communities. And I think that that's not really a very wise choice to make. I think that it is up to the directly elected mayor to engage and cooperate with councillors and actually make sure that councillors on the ground and our demands that come directly from our constituents are actually engaged with in a real way by the government. So I think that I'm kind of jealous that in Cork City Council we're not going to have someone like this. But I think that I think Laura would be excellent in the position because she brings a cooperative kind of approach to it, and a listening approach and a compassionate approach. Sorry for jumping in.
That's okay. We'll take all the answers and the questions. Okay, so this one kind of made me laugh, so I'm gonna ask it. There's a lot of jargon in a lot of what's being spoken about at times. A lot of buzzwords. Can you explain this co-create idea?
Absolutely. But before I explain co-create, I want to agree with the sentiment. There is an enormous amount of jargon there, and I have found people they can tend to write very technical documents, use a lot of political terms, rather than writing it in plain English so that people truly do understand. I have actually recently completed a course on plain English, and I've been applying it in my work. And how do you translate complex technical documents into something that people can actually interpret without that specific level of expertise? But I digress. Let me go back to co-creation. So co-creation is something that is incredibly important to me. I have been working in the area of co-creation, co-design for, I'd say, well over 10 years. For me, it started when I lived in Manchester, and I undertook a piece of work which was reflecting on child obesity policy. And what we did is we gathered together all the reactions that people had to that policy, or the public reaction to it, and we analysed that. And the findings from that were that people felt that it was a paternalistic approach. They had complete distrust in professionals, that this was somebody telling them what to do, but they knew better themselves. And it's actually something that probably set me on this political path, but it is also something that brought massively into my career over the years. So co-creation is when you design with the people most impacted by whatever it is you're designing. So be it a plan, a policy, an intervention, whatever it is you're designing. It's about bringing them in at the very, very beginning, doing all your brainstorming with them, and then bringing them the whole way through the process with you as co-authors, as opposed to consultants. That they're involved in every aspect of it, every trial of it. We often think about intelligence or expertise as something that's the private skill of individuals. And this leads us to take an expert-centric approach to things, bring in a consultant on something. What I have learned in my career is that the people impacted the most, they are the experts. They know best what will work for them. If we place those voices at the center of decision-making, it leads to success. It is a lot more upfront work, but what you will find is that in the long run, it leads to more efficiencies, is more cost effectiveness, because you get it right the first time round. There's less the trial and error. It does something else as well. It gives people agency. It gives them control in their own lives. And that type of agency control, that promotes feelings of belonging and ownership. And if we can do that, if we have if the people of Limerick feel like they belong to Limerick and they own Limerick, think of how great we could have, or how great a Limerick we could have.
Thank you, Laura. I think we are going to wrap up now. So I'm just going to give a few last pieces of information before we do so. Firstly, Laura's bio is on our website. And that is raoirta.ie/people, Raoirta, which is RABHARTA.ie/people. And we will share the preliminary program also on our website, and that is available at raoirta.ie/files. So raoirta.ie/files. I'll put it in the chat as well, unless someone else would like to do that for me. It will also be on social media. We welcome your input for that. Also, if anyone has not had their questions answered today, please do add your email address into the chat, and I will locate your question and we will answer it over email if you are up for that. Very keen to answer questions, basically. I think you've probably gotten the message that we would really welcome your input across the board, and we would also welcome your financial support. We are an emerging party and elections are a rich man's game, as we are learning, and that is a reason why it is so difficult to access policy making and to contribute to local authorities and at government level. Most people are very much kept outside the pale when it comes to this. We very literally need to be crowdfunded. If you like what you have heard today, we will share Laura's GoFundMe details shortly on social media. Or if you don't have the funds, we would love to see you on the campaign trail. You can join Raoirta at our website if you would like, but equally, we're happy to have canvassers from other parties or of no allegiance as well. And it will be an excellent way to connect with a community of people engaged in climate and social justice. We will have an in-person launch in early April, featuring Laura and our 2 European candidates and local authority candidates. Please check our social media and we will send further details to members. Please email me to request a transcript of today's session. It's aislingkiley.raoirta@outlook.ie. I'll put it in the chat again as well, but it's AISLINGKIELY.RABHARTA@outlook.ie. Thank you all so much for joining us today. We look forward to meeting you online or hopefully on the doorsteps very soon. Slán, goodbye.